The Eastern Cape Health Department claims that a report published in a daily newspaper this weekend is false. According to the article, the department awarded a personal protective equipment tender worth nearly 1 million rand to a company whose sole owner and director died 2 years ago. The report also says there are many other ghost companies that have been awarded tenders for PPEs, and that legitimate ones, which are on the list to receive money from the department, have not received a cent. For more on this, we're joined via Skype by Dr Thobile Mbengashe from the Eastern Cape Department of Health. Doctor, thank you very much indeed for coming on.
Good day to you as well.
When you look at that article and you read that somebody who's been dead for 2 years received a PPE tender, on the face of it, that's ludicrous. What's your response, sir?
I agree. If it was true, this would definitely gross corruption. We tested this. We found that this company actually has no PPE tender. 2, that the company was offered a contract with Public Works to do a renovation in one of our hospitals called Victoria Hospital. 3, the owner of the company at Victoria Hospital is actually alive. And I think this is very important because we actually issued the list in order to assist us to make sure that we root out corruption in the COVID tender process. What then is important is that directors of companies are usually matters for CIPRO, and we use companies that are actually listed in the CCSD, which is really the provincial department's system for control and managing of companies that deal with government, and no tenders is given to an individual.
So your understanding with regards to the logic in this article, where did it go wrong from your point of view?
I think it wanted to make a case that there are ghost companies, and it made these stories, and it's actually not true.
Are you saying that there's no ghost companies, though? Is that allegation totally false?
That allegations, the issue why we put up the list is just to make sure that everyone knows what is in the system. And if there's anyone who actually finds anything, must report it to the ICU, report it to the police. And we wanted to exactly to exclude those kind of allegations of ghost companies. And I think what's important to South Africans, we have now been very transparent. Not only is the company on, the directors of the company, the amount of tender that was given, and the name and the address of individuals is there. So it's for South Africans now to really take these very transparent processes and find anyone who's actually corrupt in the system.
Have South Africans come forward with regards to allegations of corruption with regards to this list?
Yes, they've actually come, and the Treasury system is actually assisting us to do the investigation. I think one of the most important things, obviously, there's this other part that someone was given a tender, he has not been paid. The nature of tenders is that you get an award. After an award, you get what is called a purchase order. After the purchase order, you deliver the goods, and you are only paid if you have delivered the goods according to the specifications and price. So it is quite considerable. We actually checked the gentleman who said he was awarded and he didn't receive money. Yes, in our system, he was awarded, and he shows in our logis system, which is really where the purchase orders are issued, and the tender has been assigned to him in terms of the CCSD process. So he's got access to that information all the time. When he's ready to deliver, he will then come forward and actually deliver. It will only be paid after that.
So just help us understand, because this is the allegation now, and this is the concern from people saying that the legitimate companies on the list have not received any money yet. They have not received a cent from the department. You saying?
They will not receive a cent to the department unless they've delivered the goods. So the process is a multi-stage process. So you get a tender first, and you get an award. After the award, you get a purchase order, which is logged within the CSD, where you can see against your profile. And then you decide to deliver the goods at the price and specification that was agreed upon. When the goods are delivered, you issue us with an invoice and which verify the goods, and then you get paid. So it is possible, very possible. Most people will appear on the list. They would appear as having received an award, which is true, and they would appear, and the amount that the award is quantified to, but they would only receive payments when they've made the deliveries. And all these details are available into a CCD profile of a company. So every company who has an award can go into the web, look for it, and find what exactly it is. And we also issue, in some instances, the actual notifications to individuals that you've got your purchase order. So in this company, we know that he's got a purchase order. We know that the award is in the profile. We know that the login system has actually logged him. What's outstanding is for the person to come forward and make a deliveries. And if we're happy with the deliveries, he will be paid for it.
You would admit that South Africans' confidence with regards to the process of PPE contracts is very low. All these allegations have really smashed South Africa's confidence in this process. How can we regain the confidence back with regards to, you spoke about transparency of this list. That's just one part of it, because we're dealing with a pandemic, a deadly pandemic. Thousands of people are losing their lives almost on a daily basis. South Africa, there's hope with regards to recovery, but still people have lost their lives here. What would you say to South Africans that are saying that, this is not on? We can't be dealing with corruption on one hand and lives on the other hand.
I certainly agree with South Africa. I mean, it's an extreme perversion to actually steal money that is intended to save lives. And I think what the president has done in putting up the SIU is really empowering South Africans to come forward. The availability of these lists is also another process towards that. I think what we need now, we need a kind of population and popular activism that actually says corruption is no longer acceptable, and demand that every tender that's actually issued, the directors and everyone, must be made public. And people should actually look at those lists, report it to the SIU and to the police if there's someone that is actually corrupt. I think that's the only way we can regain confidence. And I agree that the confidence in South Africa is very low. It's very unfortunate that we've got all these incidents of corruption when we really, South Africans, were really giving up and to make us sure that we are winning the battle against the COVID.
Dr. Thobile Mbengashe from the Eastern Cape Health Department, we thank you very much indeed for coming on and clarifying some of the issues. Good health to you and your family. Be well.
Thank you.